And now I'll turn it over to Emily. Go ahead.
Everyone. My name is Emily Parks. I am a chronically ill young adult. I was born with a mutation in one of my genes that affects the development of muscle in my GI system. So for the better part of about 30 years, I was on, I couldn't absorb anything I ate or drank, and I was on IV nutrition to survive. I received a small bowel transplant in 2020, and it's from there that I really became interested in the topic of medical PTSD. I think it started kind of trickling into my head because I work in behavioral health. I worked in behavioral health outside of Washington, D.C., and I currently work in behavioral health at UCSF in San Francisco. But I was seeing a lot of, I was resonating a lot with patients that I work with trauma, whether it was like domestic trauma, whether it was trauma growing up. A lot of the side effects that they were experiencing, such as feeling isolation and fight or flight responses or hypervigilance, I kind of saw within myself, but I don't come from a background that is abusive. So it really started making me wonder where it was coming from, and kind of slowly pieced together for me that it could be my experience in the healthcare system, considering that chronically ill people see a healthcare system that's much different than acutely ill people. We are more, people who have experienced big, medical events that require a lot of time for recovery. They get passed along a lot. It can be hard to find a provider. It can be a lot of time in recovery, whether that's doing like PT or other forms of therapy. And we're just more exposed to the healthcare system. And that includes both the clinical setting, inpatient settings, and, outside sources such as insurance companies. And so it's a different healthcare system that we experience. And that really got me interested in, medical PTSD, which is something I found the word just searching on Instagram. And I really started looking for resources for my own medical PTSD, and I didn't find any. And so that's why I created my own organization, POP. And what we do at POP is, bring resources together. There's not a lot of research on it, so that's something coming down the pipeline that we're hoping to do, is partnering with a university to do research, but making modules on, what is medical PTSD for patients, for providers, recognizing it, what are resources. And one of the things we are hoping to restart again are discussion groups about medical PTSD. So for today, I'm just going to do a summary of medical PTSD. So, you don't have to show hands. You can just kind of raise your hand in your head. Does anybody here feel like medical PTSD is something they've heard and it resonates for them? I know I have. I think the first question is, what even is PTSD? PTSD stands for post-traumatic stress disorder. Let's see. Sorry, there's a lot of background noise going on. So post-traumatic stress disorder, and traditionally we see this in people who have gone to war, veterans, and that's really where PTSD started really becoming a focus. It was previously called terms such as shell shock, and it can be dated back towards, it's referenced in some Shakespearean work, and it's detailed in the DSM-5, and it comes from, how do I want to break this down? So the PTSD traditionally comes from one traumatic event. And the thing about trauma is that trauma is based on perception. One event could be seen as traumatic for me, but maybe not traumatic for Julie. And so it's really based on experience and how how you experience the event and the aftermath of the event. So PTSD traditionally refers to one traumatic event. Now, complex PTSD can refer to ongoing trauma, such as if you are in a domestically abusive relationship, and it is, you are actively still engaged in that relationship, or it could be a series of events that happened in the past. So for PTSD, it focuses on one traumatic event. So I would really more classify medical PTSD as more of a kind of complex trauma, because it's a series of events that could be ongoing as we go through our own recovery. So some of the characteristics of traditional PTSD, and let's just use the example of a veteran, is hypervigilance. So we've heard, stories of the a kid dropping a glass and it shattering, and the father, who's a vet, just kind of wigs out completely from the smallest things. So kind of, the tightness, that fight or flight response that, when being triggered by it, you're either gonna, fight it or get out of there as fast as you can. There can be a lot of self-isolation. Who's gonna understand my situation? There's a lot of anxiety. There can be depression. And so if you take all of these situations, if you take, the Vietnam vet, and you take away the background of him being to war, and you put him in this situation of being in a hospital, you can see how similar symptoms can be shown in patients. I'll use myself as an example. So I'm very hypervigilant. And before I recognized my own medical PTSD, I could tell you stories on, I remember I used to try and stack my appointments so that I could take one half day off from work. And I remember one time, one of those appointments being canceled, and I flew off, I just flew off into a rage, and I was just like, I'm never going to see this doctor again. That's it. That's hypervigilance, that I was being hypervigilant. A lot of anxiety getting to the hospital. I would enter the hospital with my head down, my headphones in, avoiding eye contact, in this fight or flight response. So I was very, very tense. And as soon as they said, okay, you can go, I'm flying out of there. Another symptom of PTSD can be problems with memory. So when you're in this traumatic event, or when you're triggered, your lizard brain kind of takes over. So we have our lizard brain in the back, and we have our rational brain up front. And when we sense danger, whether that's real danger or perceived danger, our lizard brain is going to take over. And its job is stay safe, stay alive. And so the rationale, it's totally gone. Your rational brain has no say in the matter whatsoever until the lizard brain says, okay, it's safe. And so then that's why we can kind of fly off the handle. We can suddenly flee a situation. It may be hard to remember because we are in a survival instinct, and when that's resolved, that's kind of what I would say is a moment where I come to and I'm like, wow, it was actually kind of inappropriate for me to fly off the handle because somebody canceled an appointment on me. And so that's when, patients can feel very, remorseful. They can feel, maybe I don't deserve, healthcare. I'm not a good patient. I'm a bad patient. I'm a difficult patient. So those are some of the symptoms that can come with medical PTSD. Talking about the healthcare system and medical PTSD, it's not just, when I'm talking about medical PTSD, that can come from a traumatic event such as the experience of being in a car crash. But that can also be the experience of poor communication between providers, poor communication between patient and providers, being told, your symptoms are psychosomatic, not feeling heard, not feeling, acknowledged or validated. Um, we're all patients, and we all know that, there's not great communication going on between providers and between providers all the time. And so then that can contribute to feelings of, my case isn't being taken seriously enough, or, that can contribute to feeling not acknowledged. And so it's really, I would say the battle with medical PTSD is really, how do we improve communication within the healthcare system? And that's something that providers can do and patients can do, which we can go into more. But before I continue on, are there any lingering questions from what I've shared?
Your experience has been with the US healthcare system, right?
Yes. Yes.
Okay.
Okay.
Is that it? That's it, Sim? Do you have anything
Yeah,
else to
sorry,
say?
that was my whole question.
Great, great,
I
great.
just wanted to make sure, because there's probably some differentiation because I'm in Canada, so like my experience has only been with the Canadian healthcare system. So there's probably some differences.
Yeah, there definitely is differences, but I can, at least for me in Canada, like I feel like I slipped through the cracks a little bit with my diagnosis, with all of the some of the care I got was excellent, and some of the moments of were tricky. So I don't, yes, the specific systems are very, very different, but
Mhm.
yeah, I think there are some similarities. At least
Mhm.
that's what, yeah, yeah.
Okay.
Yeah, so medical PTSD can come from, these large, ineffective systems, but also small day-to-day interactions that providers have with patients, such as waiting in a waiting room for 15 minutes past your appointment time and being like, what, did they forget about me? Um, so it's as much a battle of deconstructing systems and making them better. And I'm sure you guys have heard, all about our fantastic healthcare system. We're really just killing it out here. um, uh, and is Canada universal healthcare?
Yes, Canada is universal healthcare, but there are a lot of it's it's problematic in different ways. Like a specialist appointment can take 6 months to a year to get, you know? So
Yeah.
there are very there are different problems. Like it doesn't cost a lot to go to the hospital, but it you have to wait a long time, you know?
Well, yeah, and that can be another, triggering experience, reduced access to care, long wait lines, um, waiting all that time and finding out that the doctor's a jerk,
Yeah.
being ghosted by doctors, medical gaslighting, such as, it's all in your head, or don't worry about it, or it didn't happen like that. Instead of using things like, oh, I'm sorry that you had that experience, or, the simple statement of saying, I don't know, let me find out, which our, healthcare system really doesn't teach our medical students. There's starting to be some small changes. Um, but there's a lot of things that can trigger uh, instances of medical PTSD. It can happen in acute cases. It can happen in chronically ill cases. It can happen when you're young, old. It can. I know somebody who broke her arm when she was 3 years old, and when they took the cast off with the little saw, it cut her and you know, that experience happened in what looked like a dentist chair to her at the time, and 30 years later she freaked out at the dentist's office. So it can really lay dormant for a long time and then poke up out of nowhere.
Can you talk more about that? Because I know with my stroke, like I had it 5.5 years ago, and that was obviously the traumatic event.
Yeah.
But it was 4 years before I ever had a trauma response to anything. And then I've had multiple trauma responses, which I would consider uh, some sort of PTSD, you know?
Yeah, yeah. So it could be a couple things. It could be, the lizard brain finally being like, okay, we're safe. And everything kind of, all the trauma that came from the stroke kind of soaking in and processing. My I didn't start I probably started showing trauma responses when I was 25 from things that happened when I was 5. And that's just kind of the nature of trauma. It can like stay with us for a long period of time. It can stay dormant, and then all of a sudden it can just be like, hey, I'm here. And the thing about emotions and trauma in general is that if you push it away, it will push back. And so, the way is through, moving through that trauma, addressing the trauma, and whether that's through therapy, whether that's through like talk therapy, exposure therapy. But it's quite normal for it's quite a normal response for it to take a while to kind of pop up. It could be like, an unconscious part of your brain is processing.
Yeah, like yes, I feel like that's something. Yeah, that's exactly what happened. Yeah, I finally was able to process it. Yeah.
What helped you process it?
It's still ongoing, but I feel
Yeah.
like therapy definitely helped, and like finding safe finding the tools when I feel something coming on, when I'm triggered, like knowing the tools that I just need to like ground myself and like bring me back to a rational minded person,
Yeah.
before it gets out of hand. Yeah.
Yeah, yeah. So grounding techniques are an excellent one, and that can be as, there's so many grounding techniques. One of my favorite is, wherever you're sitting, laying, or standing, just feeling the chair beneath you,
Yes.
feeling the floor beneath you, feeling the air come into your lungs, feeling your clothes against your skin, deep breaths, and just trying to be present in the moment. A lot of the times when we have these, when we feel triggered, it's go 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 go,
Yeah.
run away from the perceived threat. And so it, kind of bringing it back to, I'm here right now, I'm safe right now, let me feel the ground, let me be present in this world and present in this space.
Yes, that's exactly what's helped. Yeah, like 5 things you can see, 3 things you can smell, that technique as well. And breathing techniques have honestly helped me as well. Yeah.
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 I was wondering the term that you used, medical gaslighting, I find like it's a really interesting and like I'm sure very pertinent phenomenon. And I have to imagine, like, I'm not a stroke or brain injury survivor, but I have to imagine as a young stroke survivor and not knowing necessarily the cause of the stroke, that that's something that you might come across a lot is, if you come forward with like your own sort of theories or ideas and this like desire to kind of figure out the why, that you might be met with quite a bit of that. So I'm curious to hear, Emily, from you, not in terms of a stroke, but just in terms of chronic illness, and then anyone else who's maybe experienced something like that.
Yeah, so anybody, any stroke survivors want to answer first, and then I can answer second?
Take it away, Emily.
Okay. Okay. So I know that I've experienced, so I come from a family that's very much in behavioral health. My dad's a physician, so he did a lot of research. And one thing that I noticed growing up is that doctors would listen to him, but they wouldn't listen to me, even when we were saying the exact same thing. I think there is definitely a power dynamic between patients and providers because they've gone through so much schooling, and there's more weight that's put on that than the experience of the patient. But using myself as an example, I've been sick for 30 years. And so how many times have I gone through medical school in a way? Like medical school is like 4 years. So you could say that I've gone through medical school like 6, 7 times. So I truly, it's, there is a culture. So I hear among doctors and, in the curriculum of medical students that of course there are ill-informed patients who do go on, WebMD, or they do, have theories of their own that just don't really add up. And that could be from lack of information. That could be from a coping mechanism, like, oh, I have cancer because, I was a bad kid growing up, that kind of stuff, rationalizing. But there are patients out there that are like, I've done the research, or, I noticed this symptom. And there's also this kind of cultural expectation that the doctor knows all and that they know all the answers, which is difficult for doctors because there are times that they definitely don't, which makes it harder for them to say, I don't know. But the power of saying, I don't know, is that it's first authentic. And without good rapport, you're not going to have good treatment outcomes. But then, there's this pressure to know all. And, there's this kind of, every mother wants their son to be a doctor, this kind of, success. What is success? Kind of mindset. And I believe that it's come from, it probably surfaced, 60, 70, 80 years ago, and it's just kind of been recycled as the last generation teaches the new generation of medical students, and it's just kind of been passed along. And so with that, when doctors are in situations where they don't know the answer, and that can especially be hard in complex cases, them saying, I don't know, actually can kind of burn a bridge. I mean, not saying, I don't know, saying, kind of giving some explanation that there really isn't an explanation. It's just, to buy time can burn rapport, because like I said, good rapport is the key to good treatment. Is not the key, but it's an important player to good treatment outcomes. And there's just this disconnect and this devaluation of the patient experience, because when you think about it, the doctor is an expert in the general medicine and whatever their specialty is, but each of us are experts in ourselves. We know ourselves, and we are the outliers because we're experiencing different symptoms than, the baseline of a normally healthy person, because we're not, whether it's GI, whether it's stroke, TBI, that sort of thing. So there's just a huge disconnect that's slowly being dismantled, but it takes a lot of trust and partnership with providers, and really finding your team that's gonna believe you and understand you. But with medical gaslighting, I think it just I think it's a byproduct of this disconnection. Did that answer your question?
Yeah, Sarah says in the chat, I can't always put into words what I want to say, but I find a lot of good quotes on Pinterest. And then I'm going to read the quote that she like the meme that she posted. Don't confuse your Google search, doctor. Don't confuse your Google search with my 6 years at medical school. Patient. Don't confuse the 1 hour lecture you had on my condition with my 20 years of living with it. Which is
Exactly.
exactly what you're saying.
Yeah.
Yeah. We are the experts of our body. Yeah.
And it's hard. It's hard for the providers to tease out, what patients are maybe, fudging the lines a little bit, maybe not paying very close attention to their symptoms, saying, yeah, I'm taking that med, when maybe they're not taking it very consistently. It's hard because each of us kind of take our health with we take the seriousness of our health differently. So, some of us spring into action and get super informed, while some people take a more passive approach. And so, understandably, it's very hard to tease, as a provider, to tease out, who means business and who is, coping with this in a passive manner. And what do I believe and what do I not believe?
Yeah. Is there any other questions from anybody? I have a question. I actually have two questions. What is the lizard brain? What is that?
Yeah. Your lizard brain is the oldest part of your brain. It's the most prehistoric part of your brain. That's based on survival. I can't remember on the top of my head what exact points of that brain is, but what pieces of the brain it is, but it's kind of, your lizard brain is, how in movies when there's a car accident, people who are witnessing the car accident flinch? That's their lizard brain.
Cool.
That's the kind of unconscious reaction that has a lot more power than we think it does. It's also the brain that categorizes people, so it's where discrimination unfortunately comes from, implicit bias. Its main thing is, how do I stay safe and how do I stay alive?
And then I don't know which one I want to ask. Like with
Ask them all.
the traumatic event, like do you like I know what happens to me. Is there typical symptoms or is it all over the map? Like, and can you describe some of the symptoms, you know?
Yeah. PTSD, I mean, the symptoms can be all over the map. People can experience, there is no set series of symptoms, and you'll kind of see that in the DSM-5, they'll be like, oh, here's a list of symptoms, and if you meet like 9 of them for this many weeks. So some common symptoms can be flashbacks, feeling like the trauma is happening right now. So for the war veteran, that can be having a flashback on 4th of July because of all the explosions going on, and suddenly you're back on the battlefield. For the patient, it could be that you're just minding your own business and you suddenly smell the faint smell of like antiseptic, and then bam, you're right back in a procedure room. Intrusive thoughts or images. So for the war veteran, that could be they're just minding their own business, and maybe they're, I don't know, let's say it's a barbecue, and suddenly they're having flashbacks of one of their comrades that became unfortunately disfigured. For the patient, it could be intrusive thoughts such as, I don't deserve care, I'm a bad patient. It could be hey, remember this procedure, hey, remember this surgery, remember this pain, like, and you're like, go away, thought, like, go away, and the thought will not go away. It's kind of following around, or it pops up at weird times. Nightmares. So nightmares of being back at war, or nightmares of one nightmare I've had time and time again is I'm on a bed and I can't move, and there's people doing like stuff to my body, like putting in like needles and poking and prodding, and I can't say anything and I can't move. Intense distress at real or symbolic reminders of trauma. So again, that could be the I just pulled up my PowerPoint. That could be intense distress at for the patient, that example could be intense distress at an appointment being canceled.
Yeah.
It's not a trauma. An appointment being canceled is not a trauma. It would be a perceived threat, but I broke down crying. Physical sensations such as pain, sweating, nausea, that could be the presence of some you go to the hospital and you start for maybe a just a regular clinical checkup, and you're suddenly having all of these weird symptoms, or you're like, am I dizzy? Am I not dizzy? Am I don't know. Like when you start second guessing your own symptoms, it really is like trauma can really mess with your perception of what is real and what isn't, because of that whole factor of perceived threat versus real threat. Because really you could talk yourself into anything being a threat.
Yeah.
We have a question in the chat from Claudia. Can medical PTSD trigger or connect with earlier or other trauma? I find when my medical trauma is triggered, it often raises trauma from earlier non-medical events for me.
Yes, it definitely can. So I know at the beginning I said that I didn't come from an abusive household. That's something that I kind of like, I actually did. Sorry guys, I lied. For the simplicity of the presentation, I'm like, no, I didn't. But minimally, yes, there was some abuse early on in my life, and they're definitely connected. People who experience trauma at an early age are predisposed to, maybe not predisposed, but they're more likely to find themselves in other traumatic events, other and one trauma can easily trigger another trauma, which can you find yourself in similar situations, and this can be because when we experience trauma, it really kind of carves out new neural pathways. So there are brain changes that happen, and so how we connect things, or things like our communication style, can change, because in the back of our heads we're like, don't let this thing happen again. So it can definitely connect. I mean, there's definitely things that about me that I'm like, oh yeah, that's a trauma response, but I'm not sure which traumatic event, and it could be both. So yeah, they can totally meld together. Sorry I lied to you guys.
How often would you say you have like a triggering event or experience symptoms of trauma?
Less and less as time goes on. What really helped me was being like, oh, this is PTSD. But I would say so the majority of my medical events happened when I was very, very young, and it impacted how I saw the world and how I saw myself in the world, and my ability to connect with other people, which then impacted my ability to make friends, to sustain friendships, my willingness to be outgoing with others. So, there can be these kind of, changes in behavior, and then these episodes, these, feeling triggered episodes. Um, I found that once I recognized that I had medical PTSD, I actually started seeking out kind of like exposure therapy. I was seeking out events to trigger it, to lower the intensity of triggering. And so it was pretty frequent, but it was always like in relation to making friends with other females. I grew up with a lot of brothers. So I don't have sisters. Romantic relationships. I have a lot of social anxiety. So going out to social events and making small talk. So sometimes that would spring up at work if somebody engaged me with small talk, or if I was just out and about and somebody like flirted with me, I'd be like, I don't know what. But it kind of, it really depends. It really depends. I think it depends on how much the trauma is like, kind of peeking out from the bushes, being like, I'm here. You gonna deal with me? And how much you're exposing yourself to instances that can trigger you. You can definitely live a life avoiding everything that triggered you, but it's a lot more restrictive of a life.
I have a question.
Yeah.
You're saying that something that helped you was like simply just understanding like, oh, this is medical PTSD. How did you go about like processing that? Because you said like it wasn't a term that you were familiar with, you like stumbled upon it, and even then there wasn't a lot of information. So what was that process like for you? Like recognizing, oh, this might be what I've been experiencing, and then kind of going backwards and processing how A, B, and C might have led to all of these experiences you were having presently.
Yeah. So for a long time, I was like, yeah, I have this chronic illness and I have like organ failure, but I'm okay. I'm well adjusted. It's not a big deal. And that was very young me. And I think as I began to study psychology more, that was just what I studied in school. And I really started studying psychology because my family's behavioral health. I started looking at it from an academic lens. So what's very interesting to me about medicine and surgery in particular is that it is let me use an example. So they did brain scans of seasoned criminals and seasoned police officers, and they found that they both have similar brain activity. They're similar people. They just went down a different path. One went down a path of good and the other bad. And aren't surgeons kind of like that with like, I don't know, murderers in a way? They just went down the good path. Because when you really think of surgery, it is the socially acceptable act that is at its core intrusive and a little violent. It's cutting people and doing stuff and sewing them back together and them living. So academically speaking, I was like, that has to be, going through a surgery has to be on some level a traumatic event, because what's going to happen to you. You're going to live, but there must be a part of you, an unconscious part of you, because people always get nervous before surgeries for good reason, because their lizard brain is like, that guy is going to like do surgery on me. And so realizing that and thinking about trauma and the healthcare system in a very academic lens, I was like, well, this has to be traumatizing to somebody. I mean, this is kind of like socially acceptable banana stuff. And so it was really, I don't know, kind of breaking things down and breaking my own experiences into kind of very concrete ways that maybe a child would understand things, and how an adult may perceive it differently, and how that could result in trauma. So one example is informed consent. And I'm not saying that we should, I mean, I'm pro informed consent, of course, but children do not have informed consent. And I'm not saying we should give children informed consent, because if I was a child and I gave informed consent, I'd make horrible decisions. But there were times that my parents consented to something that I necessarily didn't consent to, and that didn't stop me from saying no and fighting back, and sometimes literally physically fighting back. And I was kind of thinking, okay, how would a child interpret an event like this, which would be rather scary? I said no, and it happened anyway. But from an adult point of view, it's like, well, it's for the better. Like, I needed the surgery to live. And how that difference could be confusing to a child and not to an adult. And I think we overlook how kids can interpret things and how smart kids can actually be. And then taking an example like that and thinking, well, no wonder romantic relationships make me nervous, because the majority of my physical interactions with other people have been poked, prodded, or held down. And so, of course, like, intimate relationships is going to be difficult. And so really it was stepping back with an academic lens. And I see a question: how can a procedure truly be consensual if there's no safe way to opt out, plus the power dynamic of patients and doctors? That's a very good question. It's a question that I struggle with. Is it? Yeah, I don't have an answer to that. There are, ethical papers out there, like, how can there be a true informed consent without the patient holding a medical degree themselves? Like, is there such thing as a truly informed consent when one member of the party is not as advancedly educated as the other person, and there is a power dynamic in one person having more advanced education than another?
I have a question.
Yeah.
So my stroke was just about 2 years ago, and I had it while I was working out. And at first, my first year, I was grateful to be alive. And I just I don't think I processed my trauma.
Mm-hmm.
And then it hit me,
Mm-hmm.
what had actually happened. And now a year I was great. And now the last 6 months, it's not great.
Yeah.
Like, will it always wave? Will it ever just be great again? I need something to hold on to.
You can recover from medical PTSD. It is possible, but the ebbs and flows
are just very real and something I need to learn to live with. I just, like, the first year was so great.
Yeah.
And then it wasn't.
I know that PTSD is something that you can recover from, but I can't say that the ebbs and flows will stop, because they haven't stopped for me, but it does get better with time. It gets easier. It gets less intense. You get more used to it, so to say. You kind of say, oh, okay, this narrative again, or this thought again. You're like, I'm onto you, brain. I know what story we're doing.
I had gone back to the gym and I was feeling really great. And then about 6 months ago, I went to walk in and I couldn't even walk through the door. It was a horrible panic attack and it just brought everything back. And
Yeah.
now I can't even go.
Well, and with that, it's being patient with yourself, taking small steps. That may mean like, just going to the parking lot of the gym and sitting in the parking lot. And the next time walking through the door. And the next time walking through the door and sitting next to one of the machines. And then, just little baby steps each time and breathing with each, and just, when the panic starts coming in, just saying, I'm okay, it's okay, this is okay. This is a normal reaction. And, just taking it, there's no rush in recovery.
Thank you.
Yeah.